In this short video we will talk about Trelegy Ellipta inhaler. What is Trelegy Ellipta inhaler and use for? Trelegy Ellipta is a prescription inhaler that combines 3 medications in one device. Fluticasone furoate, a corticosteroid that reduces inflammation in the airways. Euclidinium, a long-acting muscarinic antagonist (LAMA) that relaxes the muscles around the airways, and vilanterol, a long-acting beta agonist (LABA) that helps open up the airways. Uses of Trelegy Ellipta. Chronic obstructive pulmonary disease (COPD). Trelegy Ellipta is primarily prescribed for the treatment of COPD, including chronic bronchitis and emphysema. It helps improve breathing by reducing inflammation, relaxing muscles, and widening the airways, making it easier for patients to breathe. Asthma, in some cases. Trelegy Ellipta is also approved for the treatment of asthma in certain individuals, usually adults, who need additional inhaler support when other medications alone are not sufficient. How it helps. Reduces shortness of breath, improves lung function, helps prevent flare-ups or worsening of symptoms, exacerbations, in COPD patients. Reduces the frequency of asthma attacks. It's a maintenance inhaler, which means it should be used regularly as prescribed, typically once a day, and not for acute relief during sudden breathing difficulties or asthma attacks. Here's a quick guide and steps on how to use the Trelegy Ellipta inhaler correctly. Open the inhaler. Hold the inhaler upright. Slide the cover down to reveal the mouthpiece. You'll hear a click, which indicates the inhaler is ready for use. Exhale fully. Breathe out fully, away from the inhaler, do not breathe into the mouthpiece. Inhale medication. Place the mouthpiece between your lips and close your lips around it. Take a long, steady, deep breath in through your mouth. Hold your breath. Remove the inhaler from your mouth and hold your breath for about 3 to 4 seconds, or as long as you can comfortably. Exhale. Slowly exhale, but do so away from the inhaler. Close the inhaler. Slide the cover back up over the mouthpiece until it clicks shut. Additional tips. Rinse your mouth with water after using the inhaler to reduce the risk of fungal infections in the mouth. Thrush. Use once a day, as prescribed by your doctor. Make sure to check the dose counter on the inhaler to see how many doses are left. Hope you would have liked this video. Stay happy, healthy and safe.